If you're over 60 and things have started looking a little foggy, like there's a thin layer of steam on your glasses that never quite wipes away, you're not imagining it. And you're definitely not alone. For decades, there's only been one real answer to that fog: surgery. But right now, in eye clinics across the United States, researchers are testing something that sounds almost too simple to be true: an eye drop designed to work on the cloudy lens itself. Is it a cure? Is it hype? And if you or someone you love is watching cataracts creep in, should this change anything you do today? Let's walk through it together, carefully, honestly, and without the exaggeration you'll find on a lot of other channels. Cataracts don't announce themselves. There's no single dramatic moment where the world suddenly goes dark. Instead, it's gradual, so gradual that many people adjust without realizing they're adjusting. Maybe you've started avoiding night driving because oncoming headlights seem to explode into a starburst. Maybe colors look a little duller than they used to. Whites look yellowish. Blues look muddier. Maybe you've quietly started asking someone else to read the fine print, or you've turned up the brightness on your phone without thinking twice about why. These small workarounds are exactly why cataracts are so often caught later than they could be. The brain is remarkably good at compensating for gradual vision loss. You don't notice the fog rolling in. You just notice that somehow you're using more light, squinting more, and trusting your instincts more than your eyes. That's the everyday problem. Cataracts are a slow thief, and most people don't look closely at what they've quietly given up until a doctor points it out during a routine exam. Cataracts form when proteins inside the eye's natural lens, proteins that are normally arranged in a precise, transparent pattern, begin to break down and clump together as we age. Think of the lens like a perfectly clear glass of water. Over the decades, tiny particles start drifting into that water, and slowly the glass goes from crystal clear to cloudy. This isn't a disease you catch. It isn't caused by anything you did wrong. It's simply one of the most common things that happens to the human eye with enough birthdays. In fact, cataracts are so common after a certain age that eye doctors consider them less of a rare diagnosis and more of an expected milestone, like reading glasses, but for your distance vision instead of your close-up vision. The reason it deserves attention after 60 isn't fear, it's timing. Vision changes at this stage of life ripple outward into driving confidence, into balance and fall risk, into reading medication labels correctly, into simply enjoying a sunset without a hazy glare washing it out. Catching changes early gives you and your doctor more options and more time to make calm, unhurried decisions. Let's go through what to actually watch for. None of these on their own means you definitely have a cataract, but together, or over time, they're worth mentioning at your next eye exam: blurred or cloudy vision. This is the hallmark sign. It's often described less like blurriness from being unfocused, and more like looking through a piece of wax paper or a fogged-up window. Increased sensitivity to glare. Headlights at night, sunlight bouncing off a wet road, even the glare off a kitchen counter, these can suddenly feel harsher than they used to. This happens because light scatters unevenly when it passes through a clouded lens instead of focusing cleanly. Fading or yellowing of colors. Cataracts often develop a slight brownish or yellowish tint over time, which can make whites look cream-colored and mute blues and purples. Many people don't notice this until after surgery, when colors suddenly look startlingly vivid again by comparison. Frequent prescription changes. If you've needed new glasses more often than usual over the past couple of years, that alone isn't unusual. But combined with other signs, it's worth mentioning to your eye doctor. Double vision in one eye. This is less common but worth noting specifically because it can also point to other eye conditions that deserve prompt evaluation. For each of these signs, there are also harmless explanations. Dry eyes can cause blurriness. Fatigue can worsen glare sensitivity. A stronger reading light can simply mean your eyes need more light now, which is a very normal part of aging even without cataracts. This is exactly why symptom tracking, rather than self-diagnosis, is the smart move, and we'll come back to that. Here's something that surprises a lot of viewers. Cataracts almost always affect both eyes, but they rarely progress at the same speed in each eye. That means one eye can compensate for the other for a surprisingly long time. Your brain quietly favors the clearer eye, and the weaker eye's decline gets masked, sometimes for years. Many people only discover how much vision they've lost in one eye when they happen to cover the good eye and are shocked by what the other eye actually sees. This is one of the best reasons to get eyes checked individually, not just as a pair, and it's a detail your eye doctor is specifically trained to catch that you might miss entirely on your own. So what exactly is going wrong inside the eye? Picture the lens of your eye as being made up of incredibly precise, tightly packed protein fibers, almost like threads woven into clear glass. When you're young, those proteins are arranged in an orderly pattern that lets light pass straight through, uninterrupted. As the decades go by, some of those proteins start to misfold, meaning their structure warps slightly and clump together, the same basic biological process, interestingly, that shows up in some other age-related conditions in the body. Once enough of these clumps form, they scatter light instead of letting it pass through cleanly. That scattering is what creates the blur, the haze, and the glare. For a long time, surgery has been the only reliable fix because it doesn't try to unclump those proteins. It simply removes the clouded lens entirely and replaces it with a clear, artificial one. It's one of the most common and successful surgeries performed in the United States today. But researchers have long wondered, what if, instead of removing the lens, you could find a way to gently dissolve or loosen those protein clumps before they progress that far? That question is exactly what's driving the new wave of research you may have seen in the headlines. This is the part where I want to be very careful with you, because headlines love the phrase, cure for cataracts, and that phrase is, at this point, ahead of the science. Here's what's genuinely happening. Scientists have been studying naturally occurring compounds, substances the body already produces, that appear in laboratory and animal studies to help reduce the clumping of those lens proteins we just talked about. Early research in this area first emerged from investigations into rare inherited childhood cataracts, which led scientists to a compound the body makes naturally, and which seemed, in lab and animal testing, to help lens tissue regain some clarity. Since then, different research groups and companies across the country have been cautiously moving this idea toward human trials. Some early-phase human studies, small, carefully monitored trials, have reported modest improvements in vision and contrast sensitivity for people with early-stage cataracts using investigational drop formulations. More recently, newer trials have begun enrolling patients specifically to test whether a refined version of this approach is both safe and effective enough to move toward larger studies. I want to underline 3 words in everything I just said: early, modest, and investigational. These are not FDA-approved treatments. They are not available at your local pharmacy. They have not been shown to reverse advanced cataracts, and no eye drop has yet been proven in large, rigorous trials to replace the need for surgery in significant cataracts. As of today, the only treatment universally recognized by eye doctors as consistently effective for restoring vision loss to cataracts remains surgical lens replacement. So is this the end of cataract surgery? Not yet. And possibly not for a long time, if ever, for people with more advanced cataracts. But it may eventually become a meaningful option for people caught in the earliest stages, potentially delaying or even reducing the need for surgery down the road. That's genuinely exciting science. It's just not a finished story. While the drops are still being studied, there are things happening in daily life that can influence how cataracts progress, or at least how comfortable your vision feels along the way. Sunlight exposure. Ultraviolet light is one of the more consistently studied environmental factors linked to faster cataract development. Sunglasses that block UV rays aren't just about comfort. They're a simple, low-effort habit with real backing. Hydration. The lens of the eye, like most tissue in the body, depends on proper fluid balance. Chronic dehydration doesn't cause cataracts, but it can worsen the dryness and blurriness that sometimes get confused with cataract symptoms. Diet. Diets rich in antioxidants. Think colorful vegetables, leafy greens, and fruit have been associated with somewhat healthier long-term eye tissue in observational research. This isn't a guarantee against cataracts, but it's a reasonable, low-risk habit either way. Smoking. Of all the lifestyle factors studied, smoking has one of the more consistent associations with faster cataract progression. Reducing or quitting is one of the few habit changes with genuinely strong supporting evidence. Blood sugar management. For those managing diabetes, well-controlled blood sugar has been linked to a lower risk of earlier cataract development, since elevated glucose levels can affect the proteins in the lens over time. Medication side effects. Certain medications, including some long-term steroid treatments, can be associated with cataract development as a side effect. This is not a reason to stop any prescribed medication. It's simply useful context to bring up with your doctor if you're already managing one of these prescriptions. None of these habits are miracle prevention, but together they represent the kind of steady, unglamorous care that tends to serve people well over decades, not because any single habit is powerful, but because consistency adds up. If you've read this far and you're wondering, okay, so what do I actually do? Here's the grounded, low-risk answer. Wear UV-blocking sunglasses outdoors, even on cloudy days. Keep up with a generally balanced, vegetable-forward diet. Stay hydrated throughout the day rather than in occasional large amounts. If you smoke, consider talking with your doctor about support for quitting. If you manage diabetes or another chronic condition, keep up with your regular monitoring. And perhaps most importantly, keep a simple, casual log of your vision. Not a spreadsheet, just a mental or written note. Headlights seem brighter than usual this month. Or, I've been squinting more at the newspaper. This kind of tracking turns a vague feeling into something concrete you can describe accurately at your next appointment. Some situations deserve a phone call sooner rather than later, not because they're necessarily dangerous, but because early evaluation gives you more options. Contact an eye doctor promptly if you notice a sudden change in vision rather than a gradual one, if you experience new double vision, if you see new flashes of light or a sudden increase in floaters, or if vision loss is affecting your ability to drive safely or manage daily tasks like reading medication labels. Sudden vision changes in particular should never be brushed off or waited out. They're worth same-day or next-day attention, because a handful of eye conditions that feel similar to cataracts on the surface can be genuinely time-sensitive. For everything else, the slow, gradual fog we've been talking about, a routine, unhurried conversation at your next scheduled eye exam is completely appropriate. This isn't something that requires panic. It requires attention. Many people assume that cataracts only affect the very elderly. The reality is that early lens changes can begin showing up in some people's 40s and 50s, long before most people think to ask about them. Many people also assume that if surgery isn't urgent yet, there's nothing to do but wait. The reality is that lifestyle habits, UV protection, and simply staying aware of subtle changes can meaningfully shape your experience in the years leading up to any potential treatment decision. And many people assume that new research headlines mean a treatment is imminent. The reality, as we've discussed, is that promising early trials often take years, sometimes many years, to become something available to the general public, if they get there at all. The single most common mistake isn't ignoring cataracts entirely. It's waiting for permission to say something feels different. So many people wait until vision loss is dramatically obvious before bringing it up, quietly assuming that a little blurry or a bit more glare than usual isn't worth mentioning. but eye doctors would genuinely rather hear about small early changes than large established ones. Early conversations don't commit you to anything. No surgery, no treatment, no decision. They simply create a baseline so that if something does change later, there's a clear before to compare it to. Here's what matters most from everything we've covered today. Vision changes after 60 are common, usually gradual, and rarely something to panic about, but they are absolutely worth paying attention to. The warning signs, blur, glare sensitivity, faded colors, frequent prescription changes, are worth noting, even the small ones. Promising research into eye drop treatments is real and worth following, but it remains investigational, and surgery continues to be the proven, reliable option available today. And the daily habits that support eye health, sunglasses, hydration, a good diet, and steady management of conditions like diabetes are simple enough to start right now, regardless of what the research eventually finds. Nothing in this video is meant to diagnose you, and it isn't a substitute for a real conversation with your eye doctor, who can look at your specific eyes and your specific history. Think of everything here as a starting point for that conversation, not a replacement for it. Cataracts have been part of the human story for as long as we've been able to describe fading vision. And for most of that history, there was no fix at all. Today, we have both a reliable, well-established surgical solution and a growing body of genuinely hopeful research chasing something even gentler. That's not a reason for fear. It's a reason for quiet confidence, the kind that comes from knowing what to watch for, what to do about it, and exactly when to pick up the phone. Take care of your eyes the way you'd take care of anything precious and irreplaceable, with attention, not anxiety. And if something about your vision has felt a little different lately, let this be the nudge that finally gets you to mention it out loud. This video is for educational purposes only and does not replace diagnosis, advice, or treatment from a qualified eye care professional. If you're experiencing vision changes, please consult your doctor or ophthalmologist.